Brought to you by Agilus Diagnostics.
Agilus Diagnostics.
These days, we are hearing a lot about cancer, right? It's something that's worrying everyone. Most of us think cancer happens because of external or genetic factors or because of our sedentary lifestyle. But here's something surprising. A recent study found that lung cancer is the big reason for cancer deaths in India. और सबसे शॉकिंग बात ये है कि most of these lung cancer patients have never even smoked. Can you believe that? The study published in Lancet's eClinical Medicine journal also showed that in India, people are getting lung cancer about 10 years earlier than in Western countries, where it's usually diagnosed between age 54 and 70. So how can non-smokers get lung cancer, and that too at such a young age? To help us understand this better, we have an expert with us today.
There's a recent study from Lancet journal, and there are numerous studies earlier with similar outcomes, which says that a large number of patients of lung cancer in India have never smoked. One wonders how these people got lung cancer without smoking, because we know that smoking is the commonest cause of lung cancer. The answer to this puzzle is in the air which these people are breathing. Most of the cities in India today are polluted. The air that we breathe is full of pollutants. These pollutants have same chemicals which are present in the cigarette smoke. So whether you are smoking cigarette or you are breathing 24/7 in polluted air, both ways you are inhaling those cancer causing agents, and this explains why so-called non-smokers are also getting lung cancer in pollution affected cities. Environmental factors and genetic predisposition plays a huge role in the causation of lung cancer amongst non-smokers. So the polluted air which we breathe contains the same chemicals which are there in the cigarette or BD smoke, but not all smokers develop lung cancer. Similarly, not all people breathing in polluted air will develop lung cancer, and that's where the genetic predisposition comes into picture. If you have some kind of genetic makeup which predisposes you to the development of cancer, in case of exposure of your lung tissues to that cancer causing agents, then you have more chances. So in a susceptible milieu of a genetic predisposition, exposure to environmental toxins leads to development of lung cancer, and this explains the rising incidence of lung cancer amongst non-smokers in India, which is a heavily pollution infested area. So there is a strong need for raising awareness amongst the masses that these days even non-smokers are as prone to develop lung cancer as the smokers are. Most of the people feel that non-smokers are immune to lung cancer and it will only occur in smokers. So when non-smokers develop some symptom like cough, maybe blood in the sputum, and the doctor asks, do you smoke? Oh no doctor, I don't smoke. So suddenly the moment you say I don't smoke, that lung cancer is taken off the possibilities of diagnosis, which is what is leading to a lot of these patients presenting late in the stage of the disease, because lung cancer is never considered in them. Similarly, lung cancer is now occurring at younger age, and we know that in India, in younger age, tuberculosis is also a cause of symptoms which are similar to the symptoms of lung cancer. So these two things are often leading to missing of lung cancer cases even when they present early. So there is a strong need for raising awareness amongst masses about two things. One, lung cancer now is occurring and can occur in non-smokers also, and two, it is occurring at younger and younger age groups. So even in 30s, when people have symptoms which are suggestive, they should be worked up for ruling out lung cancer rather than thinking that no, lung cancer cannot affect at this stage. It's very important to do this public awareness program. So the treatment of lung cancer patients who have smoked or who have not smoked, this does not change. So whether you get cancer because of smoking or you get cancer because of exposure to polluted air, the treatment of lung cancer remains the same, which is primarily that if detected at an early stage where the tumor is still confined majorly to the lung, or at the most has spread to one lymph node station, then surgery, and preferably keyhole or VAT surgery, which is our specialty, is the procedure of choice. Once the tumor has spread to multi-level glands in the middle of the chest or to other organs in the body, which means a metastatic disease, then a combination of systemic therapy, which may have chemotherapy or targeted therapy or immunotherapy. All three are classified as systemic therapy because it goes into the system and can affect tumors at all the sites in the body, or sometimes radiotherapy. These are the various options which are never used alone. They're usually used in combination, which could be concurrent or sequential depending on the condition of the patient. So lung transplantation is not an option for patients with advanced lung cancer.
It's clear that lung cancer is not just about smoking. Awareness, early detection, and understanding the risks are key to tackling this growing concern. That's all for today. Keep watching Doc Talk on FitTalk, and don't forget to like, subscribe, and share.